All right, let's dive deep into the human body today and talk about two of its most incredible and honestly, most underrated organs, your kidneys. You probably don't give them much thought, but they are working nonstop for you every single second of every single day. So let me just ask you, do you have any idea what your kidneys are up to right now as you're listening to this? I mean, they are constantly on the job, and what they do is absolutely critical to keeping you alive and feeling good. Just to give you an idea of the sheer scale of their work, get this. They filter about 200 liters of blood every single day. That is like filtering an entire large bathtub full of liquid. And while they're doing that, they're also balancing all your body fluids, pulling out waste and toxins, keeping your blood pressure in check, and even helping to make red blood cells. They're the ultimate multitaskers for sure. But what happens when this perfectly tuned system runs into a problem? Well, let's start with a simple analogy. Think of your urinary system kind of like the plumbing in a house. The first major issue you can have is a clog, a blockage. And what's the most common culprit behind a clog? You've probably heard of them, renal calculi. We just call them kidney stones. And that's literally what they are, solid little rocks made of minerals that form inside your body's pipes. And as you can probably guess, a rock stuck in a pipe is never, ever a good thing. Once that stone is there, it can trigger a really dangerous domino effect. So first, the stone gets lodged in the ureter. That's the tube running from the kidney down to the bladder. With the exit blocked, urine has nowhere to go, so it starts backing up. This creates this immense pressure inside the kidney, causing it to actually swell up. Medically, that's called hydronephrosis. Now, your body is not going to be quiet about this. It's going to send out some serious alarm bells. The main signal is an incredibly sharp, severe pain called renal colic. People who've had it say it's one of the worst pains imaginable. It usually starts in your back and then kind of wraps around and down toward the groin. Along with that, it's really common to feel nauseous, maybe even vomit, and see blood in your urine. So what can you do about it? Well, one of the most powerful strategies, both for passing a stone and for preventing new ones from forming, is actually pretty simple. Hydration. A lot of it. The goal is to drink up to 3,000 milliliters, that's 3 liters, of fluid every day. You're basically trying to flush the whole system out and keep things flowing. Okay, so a blockage is a plumbing issue. But what about when the filter itself is the one that's under attack? That brings us to our second big problem, infection. We're talking about a condition called pyelonephritis. It's a really serious bacterial infection, and the usual suspect is E. coli. What happens is the bacteria travel up the urinary tract and set up shop in the kidney itself, causing a whole lot of inflammation. You can think of it as a urinary tract infection that decided to level up to a much, much more dangerous fight. Now, these infections can play out in two different ways. You've got acute pyelonephritis, which is a sudden, really aggressive attack. The symptoms hit you hard and fast. But if those infections keep coming back again and again, it can turn into chronic pyelonephritis. And that's where you get long-term scarring and permanent damage to the kidney. So how would you know if it's a kidney infection and not just a bladder infection? Well, the key clues are that the symptoms become systemic. They affect your whole body. You'll often get a fever and chills. You'll also have a really specific pain in your flank, which is your side. There's even a classic sign doctors look for called CVA tenderness. It's pain when they gently tap on your back right where your kidney is. The last category of kidney problems is in some ways the scariest, because this is the one that involves slow, silent damage that can happen over many, many years, often with zero warning signs until things are already pretty bad. This quote really says it all, and it perfectly describes our first example, polycystic kidney disease, or PKD for short. It's totally possible for people to have this genetic condition for decades and have absolutely no idea that anything is wrong. So PKD is inherited. If a parent has it, their child has a 50% chance of getting it too. What it does is cause dozens, sometimes hundreds, of these fluid-filled cysts to grow inside the kidneys. Over time, these cysts just take over, destroying the healthy kidney tissue and causing the kidneys to get enormous. I mean, they can grow to be the size of a football. And the really tragic part is, right now, there is no cure. But PKD isn't the only silent threat out there. Another massive one is directly tied to a global health crisis, diabetes. The condition that results from it, diabetic nephropathy, is the single leading cause of kidney failure across the entire world. The damage happens in stages, and it starts out so quietly. In the very beginning, tiny amounts of a protein called albumin start to leak into the urine. You would never feel it. As things get worse, more protein leaks out, And that's when you might start to see things like foamy urine or swelling in your legs. By the time you reach the advanced stage, your kidney function is in a nosedive, leading to chronic kidney disease. This whole progression is exactly why regular screening is so important for anyone with diabetes. So, we've covered blockages, infections, and that sneaky silent damage. Now, let's pull all of this together into a simple, straightforward playbook you can use to keep your kidneys healthy for the long haul. Let's recap real quick. We can basically sort all these kidney problems into three main buckets. You've got obstruction, which is a physical blockage like a kidney stone. Then you've got infection, which is from a bacterial invasion like pyelonephritis. And finally, you've got chronic disease, which is that slow, long-term damage from conditions like PKD and diabetes. And here is your action plan. The great news is a lot of this is in your control. First, stay hydrated. Drink plenty of water. Second, manage your blood pressure and your blood sugar. That is absolutely non-negotiable, especially if you're at risk. Third, listen to your body. Don't just brush off persistent pain or weird changes when you go to the bathroom. And last but not least, be careful with overusing NSAID pain relievers. That's things like ibuprofen, because they can be tough on your kidneys over time. So I'll leave you with this final thought. These amazing organs are working for you, filtering your blood, balancing your body, keeping you healthy every single minute of the day. The question is, are you doing everything you can to return the favor?